The way that housing is created for people with intellectual and developmental disabilities is going through significant changes. This module, the third in our series, will help you to understand what those changes are and how people with intellectual and developmental disabilities and their families can plan for the future. It will help you to understand the underlying concepts in this module if you have already viewed modules 1 and 2. This module and the other modules in the series are produced by the Community Support Network at Westchester Institute for Human Development. Our contact information is listed here. When we think of housing for people with intellectual and developmental disabilities, what usually comes to mind is the image of a group home. In Module 1, Introduction to Adult Services, we described the traditional group home settings available in New York State and how to apply to be placed on the residential request list through the front door office of your Developmental Disabilities Regional Office, the DDRO. Group homes are a great improvement on the institutions that they have mostly replaced, but for several reasons, the group home system that we know today is changing. In Module 2, Introduction to Self-Directed Services, we described how people with intellectual and developmental disabilities and their families and advocates can have more decision-making and budgeting authority and control over their services. Self-direction is fundamental to the creation of more housing choices. The most pressing reason for change is that research and experience have shown us that people with intellectual and developmental disabilities enjoy the highest quality of life when living in a smaller setting with fewer people. The unfortunate reality is that when more people live together in a group setting, people are in fact lonelier. The best practice of creating individualized settings is supported by the Americans with Disabilities Act of 1990, otherwise known as the ADA, and the Supreme Court's Olmstead decision of 1999, which stated that people with disabilities should be allowed to live in the least restrictive setting consistent with their health and safety. In 2005, federal initiatives began to direct that funding for services should follow the individual and be as much in their control as possible. Money Follows the Person, as this initiative is called, is also part of the Affordable Care Act of 2010. This allows people to live more integrated lives in the community. The Affordable Care Act also led to regulations that require that states receiving Medicaid funding, which pays for most residential support services, provide increased independence to individuals who are served, and that all planning for their future be based on the person's needs and priorities, rather than the needs of an agency or system. The good news is that people are living longer. At the same time, the number of people being diagnosed with intellectual and developmental disabilities is increasing. The result of both of these trends is that the number of people seeking support is growing, while the funding for services has remained the same. The group home system is very expensive, and the high cost has led to the rationing of housing and limited people's options. Younger people with intellectual and developmental disabilities who are entering the adult service system have benefited from years of integrated schooling, and they see their future as being part of their community. They do not want to be segregated. So all of these reasons, best practices, the law, regulations, and cost, and the expectations of the individuals themselves, as well as other issues related to labor and regulation, compel us to find new solutions. In the past, people with intellectual and developmental disabilities and their families looked to the state to provide group homes. That is changing, and people are accessing other options. Supportive housing can be provided by an agency that controls a property, typically an apartment, where support services are provided to the degree that an individual needs them, whether that person lives alone or with others. Some supportive housing may be certified, some uncertified. There is also affordable housing, which is created by developers who receive subsidies from the state or the federal government through tax incentives or other means to reduce the cost of building and operating a property, so that as a result, they can charge lower rents to people of low income, people with disabilities, or people who are aging. These apartments will typically be identical to apartments in the same property that are paying market rent levels. Shared living is when a person with a disability lives with one or more other people with or without a disability, and their resources are pooled, with some services received in kind. All of these housing options have different characteristics, and each individual situation is different, but the bottom line is that people with intellectual and developmental disabilities will have the same options for housing as everyone else. When we begin the work of helping an individual and their family to find housing, we begin with the person. The housing options that the individual chooses will affect their life for many years to come. Decisions made at the beginning of the process will have far-reaching consequences, personally and financially, so we need to focus intently at this early stage. We need to know what the individual wants from their home. Are they happy where they are now, and would they like the same kind of environment in the future? How independent do they want to be, and how practical are their current goals, and how will those goals be met in the long run? Are they outgoing or shy, and who do they generally like to be around? Do they work at a job, or can they aspire to have a paid job one day? Can they travel by themselves locally? And what matters most to them in life? Their family perhaps, or their club, or their church, or their sports team? All of these factors and more will come into play when figuring out where and how someone will want to live. We know that the more contact someone has with family and friends, the more they are part of their community at all levels, the more likely they are to feel that they have a rich life, and the safer they are likely to be. So do they have a circle of support? And if they do, how can that group be built on? Who might be added to the circle over time? And how can people help to plan for their future? If they do not have family or friends, what can be done to build their social capital? Perhaps we can find relatives or people who have been part of their lives when they were younger who would be interested in being part of their life now. Most people with long-term support needs will already be receiving Supplemental Security Income, or SSI, which in New York also entitles them to receive Medicaid. Some will also receive Social Security Disability Insurance, or SSDI, as a result of their employment or their parents' employment history. They may also be receiving Supplemental Nutritional Assistance, or SNAP, and Home Energy Assistance, or HEAP. There is a myth that if someone engages in paid employment, they will lose their benefits. This is simply not true. The Social Security Administration in particular has a range of programs that are designed to help people with disabilities retain the coverage and eligibility for services that they need while becoming and staying employed. Public benefits are complicated. It is very important that you obtain advice at this stage from a qualified benefit advisor. There is no need to do this on your own. There are different systems involved, and you will need to draw on the experience and skills of professionals. Your Medicaid Service Coordinator will help to create your circle of support and begin to prepare your plan. As described in Module 2 of the series, Introduction to Self-Direction, your self-direction broker will help to facilitate your circle of support as well, and will develop your self-direction plan, including your personal resource account. You will need to meet with a qualified benefit advisor who will help you to understand how to protect your earnings, protect your savings, and optimize your benefits. You will also need to meet with a housing navigator who can help you to understand your options, the merits of different paths to housing, and the things you have to consider and deal with along the way. At WIHD, we can help you to connect with the professionals you will need to work with. Some people think that folks who rely on public services are lacking resources, but there are ways for people with disabilities to create savings that can be used to provide for their own future. Regulations for SSI, which we discussed in Module 1, only allow for someone to have savings of $2,000, and their benefits will be adjusted when they earn income. But there are assets that are not considered in this assessment, and there are ways to protect income. These include a house, so a person who is receiving SSI may own their own home and the furnishings. They may own a car, whether or not they are able to drive by themselves. The needs of individuals with disabilities that are not met through public funding may be provided for by a supplemental needs trust. Getting a paid job will not eliminate SSI. It will reduce it, but only gradually, and there are ways to soften the impact. For example, through work-related savings plans like an impairment-related work expense, an IRWI, or a plan for achieving self-support, or a PASS plan. Both allow for work-related supports to be exempted from the calculation of income. A person with a disability may create an individual development account, or IDA, towards a goal such as home ownership, wherein savings are matched at up to 4-to-1 by a government or philanthropic institution. All are exempted from the calculations of SSI. Recent legislation created a savings plan called the ABLE account, which can help an individual and their family to save money for the individual's needs. Ensuring eligibilities and optimizing benefits while working and saving requires knowledge of complex systems. It is vitally important to seek expert advice on benefits and sound, experienced legal advice, especially on trusts and savings vehicles. Increasingly, the state is directing funding for services to the individual rather than to the service provider. The Federal Centers for Medicare and Medicaid Services, or CMS, who oversee the funding for most of the support services associated with housing, describe this change in funding streams as self-direction. As we described in Module 2, Introduction to Self-Direction, individuals may choose to self-direct their residential options. This will enable them to address their individual needs more effectively. An individual using self-direction may be able to obtain a housing support subsidy through Individual Support Services, or ISS, from the Office of People with Developmental Disabilities. The subsidy will be based on their sources of income and where they plan to live. It is vitally important that the residential planning through self-direction be aligned with the steps we have already described in order to be effective. Once you have a better understanding of a person's priorities and their personal and financial picture, you can begin to think about where they might live. Do they want to live in a city? Cities may have better public transport, be closer to recreation and work opportunities, and access to people who will provide support. However, they are likely to offer apartments rather than houses, and to be perhaps more expensive and congested. Suburbs offer more space and perhaps lower housing costs for the most part, but they may lack provider agency choice and be harder to get around without public transportation. And rural areas may be idyllic, but they may also lack medical and other support infrastructure as well as transportation. People with intellectual and developmental disabilities should be free to choose who they live with, and whether that be a person with a disability or not. That said, the need to pay for support personnel is a critical element of budgeting, and often people will need to pool their budgets with one or two other folks who are receiving support in order to cover the cost of staffing. Planning who you would like to live with is very important. So do you like similar things? Do your strengths complement each other's strengths? You are likely to spend years in each other's company. Would you be able to have a good relationship over that time? We encourage people who share their living space to draw up an agreement with each other about how they will live together, and to agree on a person who will be there to help them resolve differences before they become too difficult to solve. Once you have gone through all of these stages, understanding someone's personal needs and their priorities, what public benefits and resources they have, and how their financial picture might change, their personal resource account from state and Medicaid funds, where they want to live, who they want to live with. Once you have an understanding of all of these elements, it is time to draw up a budget that will lay out what the person can pay for and what options that budget provides. This is a good time to be thinking about all of the costs that go into renting, the deposit, maybe a broker's fee, insurance costs, and so on. Think about what it will cost to move and what the individual or their family already own that might be put to use in the new home. If the person seeks to own their own home, then they should work with their housing navigator to help with the first-time home ownership class and to go through the budget process together. The final stages of the path to housing bring all of the elements we have described together. The individual and their team can now consider their residential options. Should they own property? There is certainly pride and individual control in home ownership, but it comes with a lot of responsibilities and obligations. Should they rent property? Renting might be simpler, but vacancy rates can be low, or the property inadequate or inaccessible. Once you have thought through these costs and responsibilities of home ownership, you can use a rent or buy calculator, several of which are available online, to help you to make a decision. In 2015, WIHD published its Housing Resource Guide. This is a comprehensive guide to how people with intellectual and developmental disabilities and their families can understand and obtain benefits and other resources, navigate the adult services system, and plan for their housing future. Individuals and their families are coming up with new solutions, different ways to share their living space, perhaps with other people with or without disabilities. They come up with support from paid neighbors or family members, and with the help of technology, perform tasks that used to require staffing, but which can now be performed independently. With different ways of owning property through limited liability corporations, not-for-profit ownership, and home of your own programs, the options are broadened for everyone. This learning module is only an introduction. The path to housing can be frustrating. It is likely to take longer than you would like, but in the end, good planning and thoughtfulness will be rewarded by a sustainable long-term solution. Begin by reading the Housing Resource Guide. It may help you to organize your own thoughts. Think broadly about the kind of housing that would best suit the individual. You will need to put together a team to help you. Think about who might be on that team and how they can put you in touch with other resources. WIHD can help you with many aspects of this process. Please feel free to contact us.